Hello.
Hello, sir. It's already Friday. I hope you are having a happy Friday.
Yes, I'm happy.
How was work, Sir Logan? How was the training or the education?
Just the last week the education was over.
Mm-hmm.
The
Okay.
yeah no I mentioned I don't have every week class.
Mm-mm.
Just sometimes some week has a class or some other week I needed to prepare some other project to
Okay.
to get certification of the software and expert.
Oh.
So this week I didn't have class of the course. So
Oh. Did you have to finish a project or did you have to finish yep, another project, a new project?
I don't know. It's kind of the examination project to get
Mm.
certification of the software expert of this course, this curriculum.
Mm-hmm.
So that's the long term project. So
Ah.
after the end, yeah, maybe the end of the November,
Mm.
I need to have a presentation in front of some uh, how can I say some people who have the high grade notifications. They just
Wow.
yeah they are gonna uh, score my presentation skill and the technical level of my
Mm-mm.
presentation or my product. So they, if I pass all of the tester, how can I say? Yeah, some people who would do judgment or some scoring to the player. How can I call that?
That's right. The evaluators or the judges.
Or
If you get a good score or a good evaluation from all the um how do you call that in a presentation? All the seniors, I guess.
yes, maybe yeah, senior expert, expert,
Yes, right.
experter.
Mm-mm.
So yeah, yeah, it's a kind of the long term project to prepare for long period.
Ah.
So yeah, these days is just the start of this project. So I need to get some ideas to improve my real work.
Oh.
Yeah, the purpose of this course is using the software expert knowledge.
Mhm.
Yeah, using the software expert knowledge to improve my real work.
Mm-mm.
So this is the purpose of this course. So
Oh.
mm,
And you're going to make the presentation and your presentation has to be ready by November.
yes, this is planned at the that.
Okay. Wow. All right, sir. And then, well, now that you are done with work and you've finished work and you are home, um, well, I'm curious about your weekend plans, as always. What's gonna be your plan this weekend, Sir Logan?
So far, every weekend I went to another place, so a bit far from my hometown
Mm-mm.
because I nowadays I enjoy driving because I had a new car.
That's right.
So almost every weekend I went abroad, urban, urban, or some other province.
Yes.
Yeah, where is far from my hometown.
Mm-mm.
But
Mm-hmm.
I have some surprising news to,
What's that surprising?
yeah, just just 3 days ago I got the surgery to my shoulder.
You did?
Yes, that's why Sonny was absent to the previous class.
Oh,
So
what happened, sir?
you know, I enjoyed to playing golf, but
Mm-mm.
nowadays I realized that my golf swing has some problem. So my left arm get
Mm-mm.
weaker than right arm. So yeah, I realized that. So I just think the reason why it happened is just I'm getting older. So I just guessed my muscle will get uh, weaker than 30s. So I just don't worry just to improve this symptom. The thing that I need is just to practice or exercise for weight training to get my muscle strengthened, get strengthened,
To
like
strengthen your muscles.
yeah, to strengthen my muscle,
Mm-mm.
such as weight training or some uh, lift some weight things. Yeah, I thought just like that, but I think
Okay.
the symptom is not get better, so I decided to go to the clinic
Mm-mm. Okay.
to discuss this symptom with the doctor.
Mm-mm.
But the doctor just tests my shoulder
Mm-mm.
to many directions, to top top direction or left side or right side, back side. Then he
Yes.
said need did I needed the MRI test.
Oh,
Yeah, so after how can I say that? Yeah, the doctor watched it or examined my MRI pictures. He just yeah, he just said I need a neuron problem of the
neuron problem.
yeah. So some yeah the the medical terms is very
Hard to
difficult.
describe.
Yeah. So
Mm.
even his Korean is very difficult. So something is press my neuron, so neuron to the shoulder muscle, to control
Mm-mm.
the
Yes.
shoulder muscle. So
Mm-hmm.
that's why the muscle have gotten weaker for some period. So I need to surgery to release the neuron that is pressed from some thing. So just yeah, the time that I said this um, symptom with the doctor was Monday. So
Okay.
yeah, doctor said if I let this situation nothing not nothing to do. It's very if I just let the if I just let my muscle like this, then the
Mm-mm.
muscle would get weaker and weaker. So
Uh,
he said yeah the faster is better.
so it's better to have the surgery as soon as possible.
Yeah, if it is not urgent, but it
Mm.
needs to yeah he suggested that I got the surgery, yeah, as soon as I possible. So I just asked him to get the surgery just tomorrow.
Mm-mm. Yes.
So it just yeah. So I just went to the clinic to learn how to get strength my muscle, but I got the surgery that I
Yay!
never expected that. So I had to stay the hospital. Yeah, yeah.
Mm.
I think I can call that the hospital. Get it of hospital, not the
Yes.
clinic, because it is too big
Yeah, it's much
to,
bigger than a clinic.
yeah, because the clinic to get the surgery or um, stay the, you can say, the room that where the patient stay.
Right, right, right.
Yeah,
Good, good.
so I stayed there just 2 day on night. So yeah, after got the surgery, I
Mm.
I had to stay there one night.
Mm-mm.
Yeah, but so I because the reason I decided to get the surgery is the period is my day off. So
Ah.
yeah, because of that, I use my previous day off to get the surgery. So, but today but first I wanted to ask the holiday day off this week,
Mm-mm.
but just to, today I have some report to report to my human resources team of my education result by
Mm-mm.
today. So I needed to go to work. So even I got the surgery just 2 days ago, I went to work just from yesterday and today.
Oh,
But it's not too bad um, to uh, get the normal life.
oh, it isn't. It was not too hard to go back to your normal life.
Ah yes, yes. The the the, the time that the doctor spent to operate the surgery was just 20 minutes.
20 minutes. Ooh.
Yeah, nowadays they use some equipment not to
Mm.
cut the skin, just to, you know, how can I say that? Some scope.
Some
Uh,
school. Okay.
how can I say that? I need to use the
Sure.
dictation. I nowadays I haven't used the dictation for a while. Ah, endoscope.
Endoscope. They use. Okay.
Yeah, they used the
Ah.
endoscope to operate surgery to my shoulder.
Mm.
Just I have only 5 holes to insert the endoscope into my shoulder near the shoulder bone. Yeah,
Oh,
just to
ouch.
5 holes.
Oh my
Yeah,
goodness. And
but that's why I
mm,
came back to the normal life easily, even this work.
do you feel pain, Sir Logan?
Yeah, I'll be paying to the surgery because they cut my skin to insert the and endoscope.
Yes, that's right. To insert the equipment, the instrument.
Yeah, yeah. So, but it's not that serious. Yeah,
Okay.
like this, I
Mm,
can participate in this class, and I
mm,
can work housework and even the work in my office.
but you cannot play golf for a while.
Sure, sure. I just asked the dad, but the doctor and nurse didn't recommend to
Recommend.
play the how can I say the top sports like golf or some other. Just I need to practice to
Mm.
strengthen my muscle. So I use this dumbbell.
Oh, okay. How
But
heavy is that, sir?
yeah, this is just 50, 100, really uh, just 500 gram.
500 grams.
Yeah, like some milk.
Yeah, yes, just yeah, exactly. half
Yeah,
half a kilo of
yeah,
half
half
a
a kilo.
kilo of
Yeah,
milk,
correct, correct.
right?
I usually I usually use the per kilogram dumbbell to with
Wow.
to training, but now
Mm.
I use this cute dumbbell to stress my but but still I feel it's hard to lift this.
Oh, it's hard to lift.
Yeah, using my left hand. So,
So you are required to do that. You're required to lift that dumbbells how many times in a day?
um, anytime that anytime when I am free,
Mm-hmm.
whenever I'm free,
Ah,
yeah,
yes. And then do you have to take medicines for the pain?
yep. As I mentioned, the pain is not that serious, uh,
Mm-hmm.
but the doctor described prescribed
Prescribed? Correct,
prescribed, yeah,
prescribed.
yeah, prescribed it the painkiller and some 음, 항, 항생제 영어로 항생제 antibiotic medicine to
Mm,
prevent from
right.
the some infection.
Infection. Yes, you're right.
Yeah, so I take that just for a week. It's not that many.
Ah, okay. So you have to finish your medication or you have to complete your prescribed medication for a week.
Yes, almost per week. Yeah.
And for that physical therapy, sir, how long do you have to do that? Are you going to do that for a month or for 2 months?
Mm, until the symptom get better, I have to, yeah.
Um,
So my goal is to back to playing golf as soon as possible because the autumn is coming. So
yay!
this is the good timing to rest the golf because it's very hot outside and sometimes it's rainy.
Exactly. So you have to recover fast.
Yes,
And
correct.
yes, you have to exercise your shoulders. I never realized that playing golf can have that kind of effect or can give you shoulder pains.
Uh,
That
um, Pardon?
um,
Uh,
I never realized that playing golf can result to shoulder pains.
yeah, sometimes it causes some shoulder pain, but in my case, it is the root
Mm.
cause of the golf swing. Just to know, yeah, just to how can I say that? Uh, 선, mm, yes, I get the symptom in natural from yeah natural, the but the playing golf helped me
Mm.
to find this symptom.
Oh, that's right. So while you were playing golf, you felt the pain more.
Yeah, it's not pain, just mostly is weaker. Just I cannot,
Weak.
yeah, I cannot lift some heavy things.
Ah.
Yeah, some feel hard to lift some heavy things. You
Mm-mm.
know, in the normal life, uh, it is very rare to lift my hand over the head, right?
Right, right. Yeah, we
Yeah,
don't
yeah, we
usually
don't
do
usually
this.
to do this. Yeah,
Yes.
just type, just below the head, So,
Right, right.
yeah, every day I worked in front of the computer and just riding a bicycle to go to work or some
Oh.
driving. So I just think so far, I never lift my hand over the head like this seriously. So I think the golf, the golf swing is lift my head over the swing. So at
Yes.
the time, I think it is some weird. So I have some problems. So the first time I thought the reason why I feel that is just I'm getting older, but it
Mm-mm.
is not. This illness.
Yes, right. Well, the good thing is it's not serious or it's not too well, it's not severe.
Yes, I
And
also, but the symptoms is not gone yet. So
right.
yeah, I have to wait. Time. It needs the time to get better.
Yeah. All right. Sir, I am curious, during the endoscopy procedure, what did they do again? Did they reactivate the neurons or did they what did they do? Did they reconnect some veins or what did they do during the procedure?
Procedure. Pardon. Just
Uh
my neuron is not disconnected. Just some some some
mm,
it is in the liga lig a tor and a ligament.
torn
Yeah,
ligament.
I tore. Uh, no, not tore. Just the ligament.
Yes.
Ligament press the neuron.
Uh-huh.
Yeah, that's
Ah.
why the muscle cannot get some signal
Yes.
through the neuron because the ligament press the path of the
Mm.
signal from the brain.
All
Yeah,
right.
so operation, the the operation, I get the operation to remove the ligament that
Mm.
pressure that press my neuron.
Ah.
So yeah, it is not that difficult surgery. The doctor said.
That's why it lasted for like 20 to 30 minutes.
Yes, correct. Even though the time to prepare to get the oral surgery is long than the 20
Uh-huh.
minutes, and I need
That's
the test or oh, today I used too many medical terms.
you did.
Yeah, anesthesia,
Anesthesia.
anesthesia. Yes.
Yes.
So
Oh my
so yeah,
goodness.
took care. Yeah. So after that, but I can I could take a last 2 days without
Mm.
thinking of work and taking care of my family.
Yes.
Yeah, just
That's
the time is just for me because
exactly.
at the
That's
time,
true.
yeah, to be honest with you, I just worried about being disabled. So
Oh, I hope, I pray that that's not gonna happen, sir.
yeah, so if I become disabled before then, oh my God,
Oh no.
then then I can I can parking easily in any place. You know, there are many wide and how can I say a good place for the disabled people in the parking lot.
Yes,
Yeah, just in
yes.
front of the door. The best place, yeah, the parking lot for the disabled is placed uh, is placed in the best place of every buildings and places. So if I become that, I can park easily than now. So oh my.
But that's just one benefit, sir. For the rest, it's gonna be hard.
If
So,
I become that people, there are many benefits actually, right?
But I hope not, sir, because you still need your shoulder, you still need the strength of your arm and your shoulder to do other things. And as you have said, you want to go back to playing golf. So
Yeah,
you have
sure,
to,
sure.
yeah, you have to recover.
Yeah, the only reason that I don't want not to be the disabled is to play golf again. So,
Yeah.
oh my.
Exactly, Sir Logan. So, please take care of yourself. And I was really surprised that you underwent surgery, and
Oh
I
yeah,
really did
underwater
not
surgery.
know
Oh
about
yeah.
that. Yeah, on Monday I really thought, oh, everything is going well with Miss Sunny and Sir Logan, and then suddenly there's the surgery.
Ah yes, yes. The
Yeah.
the Sunny is the Sunny to plan to describe the situation to you in the class, but
Yeah.
she was very tired to take care of me.
Mm-mm.
So the Wednesday
Yeah.
she cannot um, participate in this class.
Yeah.
But
Yeah, I
she
see.
also feel very difficult to describe this situation because she don't want to use the medical terms like this.
That's right.
It is too difficult to her.
I agree. It is difficult. Well, it is true. It is very challenging, and
Yeah,
the good thing
challenging.
is you are there to help her.
But
And
yeah, and by the way, the good thing is that nowadays the Junso's class attitude is very get better, and
he is getting better, right?
yes, yeah, I think so. I always
Yes.
review the class that he had, but I
Mm.
think his attitude to participate, attend the class was getting better. So
Yes,
that's good.
yes.
You think
That's
so?
I definitely think so, sir, because he can answer my questions very quickly, and then he can follow the pattern very well, very fast. When I say finish the sentence, Junso, and then he finishes the sentence, which is very good.
Yes. So then I practice him to write his diary nowadays.
Oh, good.
Yes. So this is, I think this is his diary. Yeah, this is his diary. Even though I just um, Nobi? Yeah, this is his diary.
Oh.
Yeah.
My family went camping and today I played basketball with my daddy. It was fun. Oh, very
Just
nice.
I make the sentences to be honest, but he just like
Well,
dictations. But I think this
yeah,
helpful to make sentence well.
exactly. And he has good ear in English. So,
Yes, yes, that's his.
yeah, very good. Oh, very nice. Well, this is the reason why I'm so excited to have class with you guys.
Yes,
So,
yes. You are my family's teacher. Oh my.
thank you, sir. It is a pleasure. Thank you for giving me updates and for telling me Junso's progress and Miss Sunny's practicing. But for now, Sir Logan, please, I don't want to keep you here. I want you to take a rest, okay?
Okay, okay, I have to practice.
Yeah. Exactly. You have to you have to exercise. So Sir
Yes,
Logan, please be careful of your shoulders. Don't do too difficult housework on the weekend, okay?
yeah, definitely. Yeah, thank you very much.
You're welcome. And I hope to see you next Friday. Have a wonderful weekend, Sir
Yeah, you
Logan.
too. Bye bye.
Bye bye.